Hello, and thank you for listening to today's episode of JATCast, the official podcast of the Journal of Athletic Training. I am your host, Luke Donovan. This month, we will discuss two articles over two short episodes from the upcoming issue of the Journal of Athletic Training. In the first episode, I will discuss a systematic review about athletic trainer burnout, while the second episode explores experiences of external pressures athletic trainers may face within the collegiate setting. As a reminder, the article discussed today can be found on the JAT website, natajournals.org. And please remember that all content from JAT is open access to all readers thanks to the funding from the National Athletic Trainers Association. The title of the first article is Athletic Trainer Burnout, a Systematic Review of the Literature, authored by Dr. Leslie Oglesby and colleagues from the University of Southern Mississippi and Baylor University. Let's survey the scene. The notion of burnout among healthcare providers dates back to 1974, where it was defined as a psychological syndrome that includes emotional exhaustion, depersonalization of patients, and decreased perception of personal accomplishments. It is not uncommon for healthcare providers with burnout to also display decreased quality of work, increased substance use, and multiple other symptoms of depression. Specific to athletic trainers, there's a decline in the number of athletic trainers after the age of 30. The rapid decline in professionals may be driven by burnout, which ultimately contributes to some athletic trainers' decision to leave the profession. Presently, a large amount of literature exists about burnout within the profession. Therefore, a systematic review of the literature may guide future research and identify key contributing factors of burnout among athletic trainers. Using the key terms athletic trainer and burnout within Sports Discus and One Search engines, the author's search yielded 558 articles. After the initial search, articles were removed if they were not published within peer-reviewed journals, were not written in English, or had a title that indicated the study was not relevant to the purpose of the review. This process narrowed the number of articles to 83, which were then further evaluated. Articles that were not original research or did not examine at least one of the following: prevalence, causes, effects, or solutions of burnout among athletic trainers were removed. The remaining articles were cross-referenced to find whether additional studies could be included. Following the entire search and screening process, 51 articles remained and were included within the review. To synthesize the results, articles were categorized by the purpose of the study, being prevalence, causes, or effects of burnout, and by the population or setting. Examples being athletic training students, graduate assistants, high school setting, collegiate or academic setting, to name a few. 29 of the articles included pertain to the causes of burnout, and these articles found that the most consistent themes were being work-family or work-life conflict, role strain, and professional socialization. The effects of burnout were reported within 6 studies. Some of the primary findings were that burnout of athletic trainers was associated with physical consequences such as headaches, high blood pressure, fatigue, emotional problems such as irritability and depression, as well as behavioral changes, where athletic trainers who suffer from burnout were more likely to report excessive drinking. Specific to athletic training populations, unique burnout contributors and links of burnout were identified within age, gender, and professional title. Some areas I would like to highlight are that women reported greater burnout than male athletic trainers and tended to leave the profession around the age of 28, whereas men were more likely to work longer and shift work setting from the collegiate setting to the high school setting, and that shift occurred usually around the age of 40. The top 2 reasons for burnout between both males and females were similar, and once again were work-life balance concerns and role strain. Some strategies to alleviate burnout in athletic trainers were reported across 7 of the investigations. There is no single intervention to decrease burnout, as the cause of burnout may differ from athletic trainer to athletic trainer and across job settings. Establishing boundaries, determining priorities, and learning to say no have been recommended to decrease risk factors associated with burnout. Considering that some athletic trainers report that the inability to say no or establish those boundaries actually contributes to the burnout. Other strategies in that instance could include developing a strong coworker and social support system. One investigation did theorize that work-life conflict could be diminished if the head athletic trainer valued work-life balance, promoted disengagement from work outside of work hours, and provided support if needed. In addition, adherence to adequate staff and structured work schedules has also been shown to improve work-life balance, which in turn may reduce the rate of burnout. The overall prevalence of burnout among athletic trainers was reported to be between 15 and 24%, depending on which subfactor was being studied. And just to remind you, these subfactors were emotional exhaustion, depersonalization of patients, and decreased perception of personal accomplishment. This rate is lower than other healthcare professionals, such as physicians and nurses. The discrepancy between professions may stem from the off-season identified by athletic trainers, in which they report provides a time to both mentally and physically recharge. However, these reported rates are most likely skewed, considering this reference study of prevalence was published over 10 years ago. As we know, the landscape of athletics has drastically changed over the past decade, where typical off-seasons have dwindled, which most likely will reduce the previously reported recovery time, and as a result may have in fact increased the rates of burnout among athletic trainers. Overall, this article was the first to systematically review and synthesize the results of countless studies, being 51, pertaining to the burnout among athletic trainers. The authors highlighted the most reported causes of burnout to be work-life conflict and rural strain. The consequences of burnout in athletic trainers are physical, emotional, and behavioral, and affects athletic trainers across all work settings. Future research should continue to measure the rates of burnout considering the changed landscape of athletics and the emerging careers outside of high school and collegiate settings. Well, that is it for today's JATCast. Please remember to rate and subscribe to the podcast, which is available on iTunes, Google Play, Spotify, YouTube, and Stitcher. You can find out more information about upcoming podcasts and other JAT events on our Twitter, Facebook, and Instagram accounts at JAT_NATA. Thank you for listening and keep a lookout for next month's JATcast.